We'll now call on Congressman Sablan for 5 minutes of questions.
Yeah, thank you. Thank you, Madam Chair, and thank you for today's hearing. Thank you also to the witnesses for coming and before us. I have a few questions, all hopefully addressed, could be by Dr. Hart. I'm gonna try this Hart, wrong, and or Dr. Kelso. Dr. Hartgrant, how do I say your name, sir, please?
I can go by Scotty if that's easier.
Okay, thank you very much for that. So I'm Congress since 2009, and one of my long-standing goals, I don't know if we can get it done soon, but is to provide a community-based outpatient clinic in the Marianas, a CBOC. I believe that my district is the only state or territory that has no CBOC. And along without a CBOC, we don't have a vet center. We also do not have access to any of the home and community-based services that we're discussing at this hearing today. As I understand it, the President has proposed a 10% increase in your department's budget for fiscal year 2022. And throughout your testimony, you discussed the strides the VA has made to increase access to these services, yet the veterans in my district still don't have access. So when will the VA make the Marianas a priority for VHA services, such as the home and community-based care?
Yes, sir. As for the first part with the clinic, I can check with primary care and others and get back with you as to anything that they've got on the works. As for home and community-based services, I can reach out to VISN and check to see if they've already got plans to how home and community-based services within your specific area what are available and things like that. So I don't have that information right in front of me specific for your area, but I definitely can get back with you.
Okay, I can tell you that this community, the community and home visits are not, home and community-based care is not available in my district. And the committee and many VSOs have indicated the importance for the VA to ensure that its long-term services and support can accommodate special populations of veterans such as women, the LGBTQ community, Native American, the American Indians, and the Alaskan, Native Alaskans, Pacific Islanders, and veterans who live in the U.S. territories and rural and remote areas. So as a matter of fact, veterans residing in Asia have been reaching out to me through their VFW comrades to help them with issues from reimbursements to COVID-19 vaccines to other issues they have trouble navigating through the system. I'm barely afloat with the issues of my own veterans, so I cannot help others, but I just cannot ignore them as well. And there are no easy asks these days for veterans who reside in truly remote areas, but the asks are vital. The VA must ensure that all veterans have access to many of these life-saving services. So what, may I ask, is the VA currently doing, and what will the VA do in the future to ensure that services, the VA services, are not only available but accessible for all of the special populations of veterans, including the veterans who reside in the Marianas?
Thank you, sir. I think part of that too is really for us understanding the differences and the needs for each of the subpopulations. We work closely with the Women's Health Group as well as the LGBTQ plus office and the Office of Equity, Healthcare Equity. So we definitely are looking in the area in which in your district. It is tougher because, as you know, there's not many of those services even available in the community. But what we are really looking at is how can we provide equitable care. And then also, there's also some special population liaisons at VISNs that are part of the transformation plan. So we really are looking at it. But the first thing is assessing, because some of those populations will have different needs. as they age than we've been traditionally used to taking care of. So yes, I think we're going to be in a constant learning pattern, but also being aware and finding out what each of those populations where they're at need.
Yeah, Madam Chair, my time is up. I will submit some questions for the records. I want to thank Dr. Scotty for responding to my questions that I have asked on many other occasions we have. But thank you very much. Have a good morning.
Same to you, Mr. Sablan. I will.